Hi everyone, it's me, Melanie, your IVF nurse. Now, as the holiday season starts to wind down and we're nearing the end of 2017, many of you are probably making your resolutions or thinking what is going to be the next step in 2018 for you. So today's post is a few tips that you will need when you're taking that next step to decide that it's time to see a reproductive endocrinologist or a fertility specialist, and how to prepare for that appointment and what to expect. One of the first things to consider when you're taking that next step to planning your family is age. So if you are under the age of 35 and you've been trying for more than a year without the use of any kind of contraception, then it's time to see your family physician, gynecologist, or walk-in clinic to let them know that you've been trying for the past year and you have been unsuccessful and you'd like to know your next steps and potentially get that referral. So once you've seen your physician and you're getting that referral into place, if the doctor is speaking to you about various clinics, please note that some clinics have multiple physicians working out of them. So if you've got a specific doctor in mind, then you do want to have that added onto the referral. Same thing, if your preference is to have a female physician, then you want to have that noted on your referral as well, just to avoid any delays in booking that first initial consultation with your reproductive endocrinologist. If you're over the age of 35 and you've been trying to conceive for more than 6 months and you're still not pregnant, then you do want to be seeing your doctor to discuss your next steps and if you should be seeing a fertility specialist. So once the clinic has called you with your appointment date and time, the tip that I'm going to provide to you is probably one of the most important ones, which is writing any questions down that you may have in advance of your appointment. So in all honesty, I'm sure everyone has done some research on Google about getting pregnant, and you've probably come across some interesting things, and you may be wondering, is this something that we should be looking at? Is it something we should be tested for? So writing down your questions is very, very important, because once you get into that fertility specialist's office, you're going to find that you become very easily overwhelmed. So having your list of questions is putting you one step ahead of the game to keeping you organized. The clinic has now reached out to you to inform you of your appointment date and time. Some clinics will email you a medical questionnaire. Some will advise you to come in a little bit earlier to complete the questionnaire just so that they can get your history. What you want to do, so tip number 2, is to be very honest on this questionnaire. So things like how many times you've been pregnant, if you've had any abortions, your lifestyle, so how much you drink, if you do recreational drugs, if you're a smoker. All of these things can lead to the doctor being better to advise you as to what you need to do in order to be successful in your cycle. As you review the forms with your fertility specialist, once everything's been completed and you've asked your questions and the doctor has asked their questions as they've gone through the medical history, reproductive history, lifestyle history, what you want to be asking, so tip number 3, is what costs are associated with any of the diagnostic tests. Is everything covered under your provincial health plan? Are some things covered under, say, employee benefits that you might have through your employer? And if not, what the cost would be for those specific tests that the doctor may order. The next thing as well, when you're asking the doctor, so still tip number 3, is that you want to know who would be your contact at the clinic. So do you have a specific nurse coordinator? Is it a team of nurses? Is it the receptionist that relays the messages to the team as per her discretion, if it's nursing related or specific to the doctor? So finding out who your point of contact is also key. And then lastly, you do want to ask if they offer fertility counseling. So if they're associated with a fertility counselor, not everybody will require it. However, patients that are undergoing third-party reproduction should be seeing a fertility counselor just so that you can discuss things like expectations, as you're going through the cycle and what to expect after. So, because you want to make sure that everybody is on the same page. If you're doing a self IVF, then the counseling may not be indicated for you. However, you may find as you go through your cycle that the stress of the cycle monitoring and the stress of just, repeatedly getting potentially a negative result at the end of each cycle, that in itself may start to take a toll on you, and it may benefit you to speak with a fertility counselor just to kind of talk you through some of those emotions that you're feeling. Partners are great. Some family members are great to speak with as well. Nurses, your doctor. But if you're having a problem really opening up, then a fertility counselor is your best bet. Please feel free to check out my website, www.yourivfnurse.com. Or you can email me at yourivfnurse@gmail.com. Wishing everybody a successful journey in 2018.